So today I wanted to go over a question that we get here at Legacy Physical Therapy all the time is what is a Kegel exercise? A Kegel exercise is kind of the layman's term for a contraction of the pelvic floor muscles. And our pelvic floor muscles are a group of muscles that are located on the bottom of our pelvis here. They go from our pubic bone in the front to our tailbone in the back, and they span side to side across our sit bones here. So if you guys are sitting down watching this video right now, you are sitting on your pelvic floor muscles. So again, a Kegel exercise is a contraction of the pelvic floor muscles. And there's actually been research done to show that, unfortunately, about 40% of women who are doing Kegel exercises are doing them incorrectly. And that is something that I see commonly here at my practice. So I wanted to take a quick moment to come on today to give you guys a little bit of instruction on how to properly do a Kegel exercise. So the pelvic floors, like I said, you're probably sitting on them right now if you're sitting watching this video. And they are intimately related around our urethra, vagina, and anus. And when we contract them, we should feel kind of a closure around those holes and kind of a lift up and into the body. So it's often referred to it as kind of a squeeze and lift type motion. So it's not just a close, it's a lift up and in as well. And so to do this, there's a couple of different ways that you can kind of focus on it, or different visuals you can use to help you try and make sure you're doing this contraction correctly. One that works well for most people is to imagine like you're trying to pucker your anus, like you're trying to hold back gas so that you didn't let it escape. So when you feel the contraction more towards the backside around the anal area, and that's fine. That's a good way to kind of get it started and kind of make sure they're feeling the right thing. Another visual or cue that I give people a lot of the times is to visualize that you are trying to pull a marble up and into the vaginal canal. And so that motion of kind of that draw up and in motion again. Another cue that you can think of when you're trying to do a Kegel exercise is to think about trying to draw the vagina up and in. I tell people to imagine that you're trying to suck something up the vagina straw, or trying to pick up a marble with your vagina and draw it up and in. So that should be that kind of gentle motion. This is not trying to squeeze as hard as you possibly can. Also should not be holding your breath or doing a big suck in and hold to do it. We should be doing it nice and gentle. In fact, while I'm talking to you right now, I'm doing a few Kegel exercises, and as you can tell, you can't tell that I'm doing them. It's a hidden exercise, so no one should be looking over at you and wondering what is going on. If you're sitting down, you shouldn't be bouncing up and down in the chair while you're doing it. That means that you're using your buttocks muscles and not your pelvic floor. You shouldn't see yourself do a big kind of lift up through the chest either. Again, very hidden focally there around the vagina and the anus. So I've given you two cues. One was pucker the anus, and one was suck something up the vagina straw. If you've tried that and you can't feel anything happening in a sitting position, try it in laying down. Sometimes when we take gravity out of the picture, it's a little bit easier to do it in a laying down position, and you can feel more movement happening. So different people are going to feel it different ways, and depending on how strong your muscles are, it might be easier to do it in one position or another. If you're still having issues, or you're just not sure you're using the right muscles, you can use a visual. So I've had patients where kind of in their bathroom or that get undressed from the waist down and use a mirror down there to look at the perineal tissue around the vagina and the anus. And when they contract, they would end up lifting up and in. You should see the tissue kind of draw away from the mirror. If you see the tissue push towards the mirror, then you are in the wrong muscle. So using a visual can be helpful. You can also use some tactile cues over your pants or underwear. You can put your finger over the vaginal opening or over the anus, and when you pucker, you should feel that tissue you kind of pull away or tense up more, not push out towards you. So that again can give you a cue that you are doing it correctly. If with all of these different cues you're having difficulty and can't seem to correctly contract them, that would be a good time to partner up with a pelvic physical therapist to get your pelvic floor muscles evaluated. They may be too weak. They may be too tight. They're already contracted a lot and you can't contract them anymore. So a whole host of things can be going on, and that's where a pelvic floor physical therapist can really kind of tease that out and help you decide on what the best program for you is to improve your pelvic floor health.